Cushing's disease is a serious condition caused by an excess amount of the steroid hormone cortisol in the blood, which is caused by a pituitary tumor that secretes the hormone ACTH. ACTH is a hormone produced by the normal pituitary gland, and it secretes the cortisol, which causes the Cushing's disease. Cushing's disease is rare, affecting 10 to 15 million people a year, most commonly adults aged 20 to 50. Women account for more than 70% of the cases.
The common symptoms in Cushing's disease are weight gain, hypertension, poor short-term memory, irritability, excess hair growth, which is mostly happens in women, ruddy face, extra fat around face, round face, and the less common symptoms are recurrent infection, thin skin and stretch marks, easy bruising, weak bone, hip and shoulder weakness, swelling of feet and legs, and diabetes. Diagnosing Cushing's disease can be difficult because other conditions share the same signs and symptoms. Your doctors will conduct a physical exam looking for signs that may lead to them suspecting Cushing's disease. ACTH measurement is when patients with adrenal causes of Cushing's syndrome have low blood ACTH levels, and patients with the other causes of Cushing's syndrome have normal or high levels. ACTH is a hormone that's produced by the pituitary gland and flows through blood to the adrenal gland to tell them to produce more cortisol. A doctor can diagnose too much ACTH by measuring its level in the blood. IPSS involves inserting small plastic tubes into both right and left-sided veins in the groin or neck and threading them up to the veins near the pituitary gland. Blood is then taken from these locations and also from a vein not connected to the pituitary gland. During this procedure, a medication that increases ACTH levels from the pituitary that is injected. By comparing these levels of ACTH produced close to the pituitary gland in response to the medication with those produced by the other parts of the body, a diagnosis can then be made. Further tests: the DS and CRH simulation test. These are not as readable in distinguishing between the causes as IPSS. Do an MRI, which involves an injection of an agent that will help the tumor to show up on the MRI scan.
Different treatments for Cushing's disease include surgery, which includes removing the pituitary, which offers a long-term cure for Cushing's disease. The cure rate for smaller tumors is 80% to 85%, and if the tumor spread to nearby internal structures, the cure rate is 50 to 55%. Another treatment is medication, but there is no effective drug that lowers ACTH production and shrinks pituitary tumor. There are only medications that inhibit the adrenal gland's production of cortisol. The last treatment is radiation, in which in some cases surgeons may not be able to remove the tumor surgically. Radiation therapy can be very effective in controlling the growth of these tumors. A 32-year-old female developed symptoms of Cushing's about 1.5 years prior to her visit at a large teaching hospital in the Mid-Atlantic. Her symptoms included amenorrhea, facial hair, acne, and back pain. Local testing showed the following results in a urine-free cortisol test of 228, 235, 265, and 248, where the normal levels are less than 50. Inferior petrosal sinus sampling was performed, which showed that the values of her pituitary was the source of her Cushing's. The patient was scheduled for surgery and underwent transcendental resection of her pituitary gland. The patient returned to the pituitary clinic 8 weeks later, and she had lost 8.6 pounds, her facial plethora had resolved, and her face was thinner.